joins me now from Bath in England. Doc, it's always good to speak to you. Do you feel that China has taken the right approach here for what could possibly be some of the longest lockdowns the world has ever seen?
So China, at the beginning of the pandemic, did extremely well with its test, trace, contain policy. And the West could learn from China's approach to that. However, further ahead, when the vaccines were invented, China, unfortunately, has fallen behind. Let me digress and explain. So we invented in the West the mRNA vaccines, and China, using its Sinopharm family of vaccines, uses those vaccines there. Now, in China, they have not been immunizing the vulnerable groups in large numbers. And their vaccine is also not as effective as the mRNA vaccines we have used in the West, meaning AstraZeneca, Oxford, Moderna, Pfizer. So China has now got a problem, which is under-immunized vulnerable population and a large number of them, plus a vaccine that they're using is not as good as it could be. So that is now a problem for China.
And there seem to be then a lot of knock-on effects to these problems that China is experiencing. What are the long-term health implications? Because even countries that are now mostly out of lockdown, especially in the Northern Hemisphere where it is starting to get a little bit cooler, there have definitely been more respiratory diseases out there and many more people falling ill as the weather continues to change.
Yes, indeed. And you touch on a very important subject, the knock-on effect. So when the Chinese population note that there is a World Cup going on in Qatar and thousands of people are out and about and mingling, and the Chinese population is told, no, lockdown for you, that's not good news, because people will eventually react against their government. Plus, what the government can do is learn from the West, which is use the vaccines that have been proven to be more effective, work better, and give longer lasting immunity, i.e. the mRNA brand of vaccines. Because otherwise, China is also an interconnected world with us. It produces a lot of goods, the microchips, parts for televisions, radios, cars, etc. So if China shuts down, the knock-on effect is also for other countries which trade with China.
And Doc, you talk about the interconnectedness of China to the rest of the world. But what about within the country itself? Because these mass bouts of isolation not only take a physical health toll, but surely it must also take a mental toll, especially among the older population who may be living alone.
Oh, absolutely. You are absolutely spot on. And whilst we may only get a picture of what's happening in Shanghai and Peking, the large population areas, a large part of China is rural. And when you are in isolation, lockdown mode, of course, it has a detrimental effect on your health. And we mustn't just measure deaths as per COVID. There are deaths because of that isolation, that mental illness, that cancer that wasn't diagnosed, that heart disease, and so on. So there are, as you say, a lot of consequences for these prolonged lockdowns when actually you could change course and say, we're going to use the best vaccines available. And the best vaccines available are the mRNA platform of vaccines that we have successfully deployed in the West.
Dr. Bharat Pankhania, always good to get your take on these matters. Live to us there from Bath. Thanks so much, Doc.